I'm going to Walter Reed Hospital. I think I'm doing very well, but we're going to make sure that things work out. The First Lady is doing very well. So thank you very much. I appreciate it. I will never forget it. Thank you.
As we've been telling you this morning, Donald Trump is now being treated for COVID-19 at the Walter Reed Military Hospital. He posted that message to Twitter last night. Part of his treatment there involves an experimental antiviral drug usually administered to severe cases. That's despite assurances from the White House that he's showing only mild symptoms. For more on our top story, I'm joined by CBC medical contributor Dr. Peter Lynn. He's in Toronto. Good morning, Dr. Lynn. Nice to see you.
Morning, Asha.
There's still a lot we don't know, right, about the president's condition. So let's just start off with what we do know. Last night, his physician said in a memo that he's doing very well, has not required any supplemental oxygen. But what do you make of that statement?
Yeah, they're looking at, has this virus set up shop in the lungs? Because remember, the virus needs to make photocopies of itself, so it invades our cells. And in doing so, it sort of damages our cells. So their first step is it affected the lungs? So they'll be watching his oxygen saturation. That's that little finger thing where they look at how much oxygen is in his blood. They can do x-rays there as well to see if the virus is doing any damage within the lung, because we know that sometimes you don't have much symptoms, but you already have damage there. So we'll keep an eye on the lungs. At the same time, they'll be monitoring his heart and his kidneys and brain function, because the virus can move into those areas as well. And that's why he's going there for monitoring.
You know, everyone's trying to read the tea leaves about his condition and how he's really feeling. We know he has a fever, congestion, a cough, but he also received an experimental cocktail of antibodies. What exactly was that?
Well, the idea is that instead of waiting for his body to make the army, the antibodies that can grab a hold of this virus and get rid of it, why don't we give him some antibodies? So initially, we used to use plasma from people that have recovered, and so you're boring those antibodies. In this case, companies have made these antibodies. There's two of them together, so that's why they call it a cocktail, and that's what he got yesterday. Put those things in there, and if there's viruses floating around, it'll be grabbed by those antibodies early so that it does not allow the virus to invade the cell. So that's why he got that treatment. It hasn't been tested in that many people. It's not approved for this, but they're sort of taking a risk. But there have been about 200 some odd patients doing it. It was relatively safe, and that's why they were giving this drug.
His doctors have also given him the antiviral drug Remdesivir. Can you tell me a little bit about it? Because from what I'm hearing, and I'm not a doctor obviously, it's supposed to help someone in a severe case.
Yeah, so this particular drug is an antiviral. So when the virus goes into the cell, it needs to take over your photocopy systems to make copies of itself. And so what this medication does is it goes in and it blocks that photocopying system. And so therefore, they used this drug before, like they were trying to use it for Ebola and for other viruses as well, and MERS and those kinds of things. But basically now they're using it in the most severe cases. And in severe cases, it worked a little bit. But you can imagine if I have tons of copies of viruses being made, it's hard to block all the photocopiers. Whereas in animal models, if you give it earlier, it actually has better benefits. So again, based on that, so not a whole lot of science behind treating somebody this early in the stage, but they're trying as well so they can slow down the virus. So the goal is slow down the virus, get rid of it if it can with antibodies so that his body has a chance to mount an immune response to it.
Can we talk a little bit about Trump, his health conditions? How risky is this virus for him at his age, at his weight?
Yeah, so basically when they look back at all the studies, they're saying who are the people that get into trouble? Because we know that this virus, in some people, no symptoms, some people very mild, and then other people end up on ventilators and dying. So what's the difference? It's the same virus. So we're looking for features in the person. So if you're older, we know that that increases your risk dramatically of either death or ventilation. Same thing with being obese, and this being male also increases the risk slightly as well. And so he has those features that puts him at higher risk. We don't know a lot about his medical conditions, but if he had diabetes, lung disease, or if he's got heart disease, those also increase his risk. So the way his body is going to respond to the virus will be in a much more dramatic way, and so therefore more complicated. And that's why they're taking all these precautions with him, because he sits in one of those high-risk categories of patients.
As we know, we're hearing that other White House officials, senior officials, have tested positive, like former Councillor Kellyanne Conway and his campaign manager. Others are being tested. When do you think we'll get a better idea of the scale of this outbreak?
Yeah, and we saw at that Rose Garden part where everybody was sitting right next to each other without masks. So it was as if it was just a normal function. And so therefore, they'll be tracking all of those people. In other words, finding if they're okay, testing them, and then tracking all the people that they've been around. Because remember, that was on the weekend. So all these folks have been around many other people. So public health over there will be tracking all of these people. Then finally we'll understand the scope of this one event might have had. And it was because everybody was right next to each other and no mask. So I think that message coming out about the mask may actually have a very good shot in the arm from this situation. And we hope that President Trump does well and the First Lady does well. But it may give a signal to people that we can't sit right next to each other. Even if people are healthy looking, they could still carry the virus and pass the virus.
Right. How big a signal, you think? Do you think this will change people's behaviors, those who were previously anti-mask?
Yeah, so I think it'll change perhaps the president's view of things. We know this when Boris Johnson, the prime minister in UK, basically when he got sick, it changed his perspective on what he should be doing with the country. Because up until then, he was saying, I don't need a mask. He was walking into crowds as well. So perhaps this scare, and I hope it's just a tiny little scare for the president, will now make him sort of say, maybe we should change the way. And perhaps this is the beginning of a good path for the United States in that they will promote the mask. Because we've had CDC, all the officials, the scientists are saying, please wear your mask, please do the distancing. But if we have it coming from the president, I think that might be very useful. And that might actually change the course of the disease in the United States.
Lots of great information. Thanks, Dr. Lin.